Hello and welcome to this educational presentation on Tele-sitter technology and why it is important for our patients, titled Tele-sitter Technology for the Safety of Our Patients. The agenda for this presentation will be to identify the intended users and the purpose of this technology and the potential risk and benefits, the effect on overall safety and care, identify requirements for the successful deployment of the technology, and discuss training for providers, patients, and patients' families. We want to discuss the issues of patient confidentiality and privacy safeguards with the technology and how the effectiveness of the technology will be assessed. We want to also discuss the ongoing training and technical support to be provided to staff and what that training schedule will look like. Post-implementation outcome measures and how they are measured will also be discussed, and at the end there will be an opportunity for any questions. The intended users and stakeholders for this technology are physicians, nurses, nurse technicians, CNAs, patients, patients' families, monitor technicians, ancillary staff such as physical therapy, occupational therapy, or speech therapies, leadership, and the community. The attendant users and stakeholders are those who have a vested interest in our organizational success and those we serve. The intended purpose for this technology is to ensure the safety and well-being of our patients and staff by utilizing assistive technology in a safe, respectful, and secure environment of care. Tele-sitter technology has many purposes and use. For the purpose of our organization, it will be to decrease the number of falls, prevent and decrease infection rates, improve patient outcomes, increase patient satisfaction ratings, improve community perception of care, increase nurse productivity, and decrease other adverse events related to this patient population. To use the technology, we will place it directly in patient rooms. The patients will be monitored by a remote technician. The technology has video and camera capability, and there is a microphone for the technician to communicate with patients when it may be necessary, and an ability to alarm for quick response time in the event that the unit has not been able to be reached by other means. It is also at times a deterrent for the neurocompromised patient and allows the nurse to care for other patients. A short-term goal of Tele-sitter technology is to provide efficient, patient-centered health care, leading to quality and safety of care for individual patients. A long-term goal of Tele-sitter technology is to improve our standards of care, leading into improved positive patient outcomes. There are potential risks and benefits in the immediate patient care setting. Some of the risks include increased patient confusion because they do not understand at times what the technology is and why it is in their room, so they may be fearful of it. We have to protect patient security and privacy and put in measures to make sure that those issues are not breached. The inherent end-user HIPAA violations or organizational data breaches have to be addressed. Timeliness of unit notification, which is another reason to have the alarm in the event the unit cannot be notified timely. Lack of team engagement if they are not part of the shared vision or feel ownership in the project. Reliability of notification methods, whether it be phone or pager, or a distracted monitoring tech who is watching 10 to 12 patients simultaneously. The benefits of Tele-sitter technology include improved quality of care, improved patient safety ratings, decreased HIPAA concerns with fewer staff having access to the patient. So instead of having round-the-clock sitters, which is multiple individuals with the one patient, you have one monitor tech watching 10 to 12 patients, so less people knowing the patient's chart, so decreased HIPAA concerns. Limited access due to information through firewalls. Real-time call notification alarm system. Team support, improved time management. Nurses are able to attend to other patients. Advanced technology and decreased costs related to decreased adverse events and decreased staff. The effect on overall safety and care includes real-time charting and improved time management, creating an environment conducive to patients feeling safe, provided for, and being given high-quality care. Staff engagement due to feeling supported, well-trained, confident, and empowered in the care they provide. Decreased infection rates by as much as 30% and falls as much as 30% or other adverse events. Improved patient and community outcomes. Improved patient outcomes, and these patients go into the community and are more productive members of the community and their families. Greater CMS reimbursements for improved patient outcomes and fewer adverse events. Improved revenues from improved community perception of care, leading to an increased number of patients choosing our care, because patients do have a choice. Improved communication, shareholder acceptance, and continual collaboration. Continued success of the technology's use. Overall improved quality and safety of care due to improved patient outcomes, costs, improved revenues, and staff retention related to the environment of care. Requirements for successful deployment of the technology include a shared vision shared by all stakeholders that brings buy-in and continual collaboration, a willingness to listen and value all ideas, good communication, training, acceptance, and engagement, monetary, capital, and staff resources, limited initial implementation allowing for changes and/or improvements, reliable network, risk management involvement to identify critical assets, operating vulnerability, inherent security risk to the organization or end users, and any other unit-specific needs. And the factors with the greatest effect on a successful deployment are acceptance and engagement. If the staff accepts the Tele-sitter's technology and is engaged in the process, they will be able to communicate ideas for improvements and change with the implementation to make the Tele-sitter technology more effective. And the reliable network refers to Wi-Fi capabilities and video capabilities, and of course notification capabilities. Training for providers includes computer-based modules, in-person training, hands-on operation, protocol engagement, helping to write those protocols to feel empowered and have ownership and confident in care, set expectations, emailed updates and reminders with any change or improvement, flyers and bulletin boards for reminders, individual reinforcement if needed, and open communication, open door policy, acceptance to ideas. For patients, training would be informed consent or explanation of care, reminders, redirection, care plan involvement, operational use explanations, setting safety goals, valuing feedback and accountability. And for families of patients, informed consent or explanation of care for patients who are neurologically compromised, care plan involvement, operational use explanations, family involvement in safety goals so they understand the importance of the effort of Tele-sitter technology, valuing feedback and accountability. Staff members play a crucial role in the implementation of the technology, the acceptance and consequent implementation process. Staff during the process will lead to invaluable feedback and improvements in real time in the setting of the implementation that only experienced frontline workers can provide. Patient confidentiality and patient safeguards with the technology. Confidentiality includes HIPAA compliance, patient approval of communication, password access if preferred, on the patient's end, meaning family, if they call for information, must have a password to be given information, and the interactions are not recorded. The camera is for monitoring purposes only. The safeguards: password-only access for staff. That means password-only access to the patient's chart. Firewalls to limit breaches in confidentiality and HIPAA information. Limited staff association, meaning limited team members in contact with the patients due to fewer sitter staff. And risk management involvement, again, for those unit-specific needs. Assessing the effectiveness of the technology involves many fronts. Before implementation, that is the process when you're reviewing all the data. You want to look at nursing journal reviews. When you're considering implementing the technology, you want to look at technology reviews. You want to have health system feedback from sister health systems who have possibly used the same sort of technology to kind of get what worked and what didn't work for them. Staff experience polls. Some of your staff may have worked with these different types of technology before and have valuable input in the implementation process. CMS feedback. What does the CMS network know about Tele-sitter technology? Does it work? Quality and safety feedback also. During the implementation, you want provider feedback, staff feedback, you want IT feedback on the setup, and of course monitor tech feedback, because they're a very important part of the process. All shareholder feedback and quality and safety feedback. And after implementation, you want patient feedback, family feedback, all provider feedback, again, IT feedback, and maintenance feedback, because they're maintaining the equipment, and again, monitor tech feedback, all shareholder feedback, and always quality and safety feedback. Ongoing training and technical support. Once the initial training is complete and the Tele-sitter technology is implemented, there will need to be a continuous environment of learning and training. Nursing staff will directly train patients and their families through verbal, written, and visual methods of learning and communication. This will further improve patient safety and patient outcomes, and this is rather individual based on educational level of the patients and their families. The training requirements will include understanding the purpose for the technology, how to alert staff, the importance of not repositioning the equipment, because the camera is set to a position where it can see the patient and the patient activity, and the use and disbursement of the collected data, what happens with the data that we collect. An emphasis will be placed on the assurance that there are no risks to patient confidentiality and privacy, no recordings, for example, and any questions raised by staff, any providers, patients, and their families, or other shareholders must be immediately addressed during this ongoing training. Questions may arise regarding safety, privacy, confidentiality, HIPAA, and standards of inpatient care, among other things. The training schedule. Well, nursing staff will receive continual training. That will include software upgrades, unexpected challenges, progress and changes implemented, equipment changes or upgrades. Nurses will be expected to be proficient in this training and able to teach back the information necessary to patients and their families. The schedule for training is ongoing and continual. It does not end. Quarterly, there could be computer-based modules annually, immediate with changes implemented, or as needed with issues arising. Different methods besides computer-based modules could be email, bulletin boards, flyers, huddle messages, one-on-one communication, re-education, and equipment representative and services. Post-implementation, there are many outcome measures, and we want to see how they are measured. So post-implementation outcome measures include improved overall patient outcomes, improved community outcomes, increased patient flow and revenues, improved CMS ratings, improved staffing ratios due to retention, improved patient satisfaction ratings, and improved quality and safety outcomes. Overall patient outcomes are due to fewer adverse events. Community outcomes are due to more positive patient outcomes affecting the community. Patient satisfaction ratings are due to patients going home and filling out their Press Ganey surveys, and improved quality and safety outcomes. Improved staffing ratios are related to nurses feeling more supported, empowered, and able to perform their job, so they stay with the organization. Methods of measurement include data collection, a statistical analysis of that data, monitoring of revenue gains, average per patient day analysis, improved HCAHPS scores, improved reimbursements from CMS for fewer adverse events and positive patient outcomes, improved retention rates, and decreased costs of education and training related to greater retention of staff. These are some references. And are there any questions? I will be happy to answer any questions that we have to put forward.